We're back here on Jones and Company, and today we are talking about the Zika virus on our program. We just heard from Dr. Glen Beneby, the Chief Medical Officer of the Bahamas. And now we have the pleasure of speaking with Dr. Felicia Greenslade, who is from the Surveillance Unit of the Department of Public Health in the Ministry of Health. Nice to have you here on the program.
Thank you for having me.
I thought I've spoken to most doctors in the Bahamas. This is the first time I'm speaking with you.
The surveillance unit, we're there, but most people don't realize that there is a surveillance unit. So yes. We're not high profile. We do a lot of work, but we're not high profile.
And so your specialty is public health?
Public health.
And how
maintaining the health of the community by making sure that no public health threats are introduced to the country, finding anything that may arise within the population itself, preventing an outbreak, and just managing everything at the source. Basically keeping the population healthy.
How long have you been doing this in that department?
Well, now this is my second stint in the surveillance unit. My first stint was in 2006, and I then left public health and went over to PHA, but then I came back just late last year.
Okay. The Zika virus, I see you have a whole lot of information on it, so you've been doing a tremendous amount of research on this, and we know of the cases in the Americas, and you're very concerned that we might be affected, eh?
It is a legitimate concern simply because of the nature of the Bahamas. We're a touristic country. Our borders are very open. So before times, it was difficult for diseases to get from one country to the next. Now you just need to get a mosquito on a plane, and your country has a problem. So it's only a matter of time, especially in this region, because the problem with the Zika virus, too, is also this. We are a naive population in that the Western Hemisphere is not previously exposed to Zika. So we have no natural immunity as such. So it's going to be easier for it to spread in this region. So the best thing that we can do as a nation, and has been alluded to earlier, is prevention. You see, the problem is the Aedes aegypti mosquito. It's here in the country. You don't want to get the virus coming into the country, and you definitely want to cut down on the vector within the country. If you strike while the iron is hot, it is still early, you get these situations under control, you are not as likely to have a disaster.
Godfrey?
Dr. Greenslade, I'm a lot older than you and Mr. Jones, right?
Yes.
I come from an era of the health inspector who wore khaki and went around with their spray machines in every community, right? And the Bahamas was very healthy then. I don't know, the last day I seen a health inspector, I wouldn't recognize a health inspector now because I presume they don't wear khaki, right?
I think they do.
They do?
I've seen some of the vector control officers wear
khaki. They do?
Yes.
But I don't know the last day I see one.
The vector control officers with the cans, with the pumps.
They wear khaki.
Right?
Yes.
How equipped is our manpower in this densely populated island of some 250,000 people?
In New Providence?
New Providence.
To date, in terms of staffing, in terms of vector control, I cannot speak directly to that because, as you realize, that's a different ministry. We do liaise closely with them.
But I thought surveillance?
Surveillance doesn't do the vector control aspect. We liaise with the Department of Environmental Health Services.
But the vector control is a critical part of the...
Yes, it is the most important part of it, the actual prevention. So we're working closely with the Department of Environmental Health towards this goal. They do have their materials in terms of their insecticides, their adulticides, which we use to kill the adult mosquitoes, the larvicides, which you use to deal with the larval stage. They have their materials, they have their vehicles, they're going out. We're actually enhancing fogging, yes, in order to make, well, it's difficult when you have the rain. Most persons are not aware that it's difficult to fog when it's rainy because everything just settles. But the weather hasn't been too bad lately, but we have planned enhanced fogging We've also planned along with DHS, to have walkabouts in certain areas, basically to edge the more, what we call our hotspot areas, where you think they'd be more prone to have an outbreak in terms of having the yards properly tended to, making sure that they don't have containers with water collecting, lying about, educating the public in general in terms of how to maintain their water storage, because there are persons who actually collect water. They still want to collect the water, but they have to be educated in terms of how to do it properly without allowing the mosquitoes to breed. So vector control with their khaki is still very much active, even though you may not see them, but they're very much active and very much involved in our efforts. So we are doing the enhanced fogging, yes, but we want the public to understand, as was mentioned earlier, prevention is the key to it. You must be able to go into your yard and realize that even something as simple as a bottle cap can serve as a breeding ground because water can collect in it. So we're doing the walkabouts in the areas basically to educate and to assist persons in their cleanup. DEHS is also moving forward in terms of getting the cubic containers to assist in cleanup in certain areas as well. What we've done from the surveillance point of view in terms of the education, we started actually from last year in terms of sensitizing the healthcare workers, public and private, in terms of what the Zika virus is, what to anticipate in terms of symptomology, how best to monitor it, because our goal really is monitoring for prevention, how to monitor it, what we're doing to make sure if we get something in country that we're dealing with it properly, though we don't want to get anything in country, but if it does occur, that is being handled properly. We're also stepping up our education right now. As you heard, we recently had a session at the hospital. We're planning for, they've requested another because some persons actually wanted to get in and couldn't because there wasn't enough room.
Dr. Greenslade, this company, Media House, is running Operation Love Your Country right now. You heard about that, right?
Yes, sir.
And we have discovered that New Providence is filthy.
Yes, it is.
And I did a program on radio and the other day. What was the theme, Godfrey?
Nastiness.
What?
Nastiness.
Nastiness. It's a nasty place. We have a whole lot of people in our country who do not recognize garbage. They don't recognize it.
Just see through it.
They are oblivious to garbage. So how are you going to fix that? How are you going to deal with such people who have a mental capacity to accept garbage?
Again, the effort is we have to do one-on-ones. We're doing the walkabouts in an effort to really educate and try to change the mindset of those persons, because there's only so much that the government, that the Ministry of Health, that DHS can do.
That's an uphill battle.
But it must be fought. It's a battle that must be fought, and it's an effort that we have to make persons understand that something as simple as just tipping over a water barrel so that water doesn't collect, and it can stop them from becoming ill, can stop them from having to worry about their child being born with a problem because of a mosquito infection.
Yeah, but you see, tipping over a barrel is one thing, but when you live on a property...
It's squalor.
When you're in squalid conditions, and you have cans and bottles and containers all over the place, and these things are collecting water. And Mr. Eneas says he doesn't see the vector control officers of the Ministry of Environmental Health.
What?
So that is why we had such a high incidence of dengue fever,
and
right?
We're preempting
Isn't
that
that
now.
why we had a high incidence of dengue fever?
Because
of nastiness?
Partially, yes. But we are preempting that simply because DHS has made it clear. They are getting the cubic containers, and we're doing the walkabouts in those areas that are more prone to having a mosquito problem because of litter. So that's what the cubic containers are going to be designated for. That's what the walkabouts are going to target, those areas primarily. We're getting assistance from NGOs to come along with us to even help in terms of distribution of repellents to use. But we recognize that the problem is there. We recognize that there are persons who keep their yards in a less than tidy manner. We recognize that.
Dr. Greenslade, this is my pet peeve, you see. In Angliston, you have tire shops.
They monitor tire
repair
shops, but they monitor the tire shops as well. DHS
Dr.
does that.
Greenslade, people are collecting old tires.
They actually monitor the tire shops. DHS goes through because they know that the problem is water collecting in tires.
But why are they allowed to even to store these old tires in Angliston, Coconut Grove, and all in Kemp Road, where you from? But why?
Well, sir, the people want to make their money.
The people want to make their money.
They want to make they want to have their livelihood.
At the risk of having people infected with Zika virus?
Which is why we go the route of ensuring that they're not growing mosquitoes at their sites.
There's another problem.
They actually monitor the tire shops. They monitor the tire shops.
Are they spraying around the tire shop?
As needed, because they do what they call mosquito indices to see how, if mosquitoes are growing at a particular rate at whichever shop, and whenever, and this doesn't just happen at the tire shops, this is what you see happening around the country, where we have artificial and natural water reservoirs, where you see, we know that, example what happened with Joaquin. Once we knew that certain things had gone in place, that there was flooding, there was extra water, you monitor more intensely. So for those areas that we know they can be potential problems, they're monitored more intensely.
Yeah, but Dr. Greenslade, these tire shops should not be allowed in residential areas.
That's beyond my purvey.
Dr.
That's
Greenslade.
beyond your pay grade?
My purvey.
Okay.
Dr. Greenslade, the Bahamas Agriculture and Marine Science Institute, commonly known as BAMSI, in conjunction with Operation Love Your Country, will be mounting a forum or town meeting on climate change. All right?
Yes.
The climate this winter has been devastating.
El Niño.
There's been excessive rain in Andros and Grand Bahama in the northern Bahamas. And it has adversely affected food production. In view of the fact that this unseasonable high levels or high degree of rain, this is going to have an impact on your program.
Most definitely, because we have
What
to
are y'all
look at...
doing? What are y'all doing in those islands, particularly an island like Abaco, where you have a high concentration of illegals, high concentration, right? Where people live in conditions as described by Mr. Jones.
That problem does not just exist on Abaco. There are other islands that we have what we call hotspot areas where you worry about conditions that people may be living in and where there are actually natural reservoirs as well.
Yeah.
But for those areas, again, as I mentioned, we have enhanced monitoring by DHS in those areas. Mosquito indices are checked on a regular basis at different islands in the country. Certain areas, certain islands receive what we call enhanced monitoring simply because you know the potential for a problem is there.
I go down this every Wednesday. I go look.
When you go, you contact the DHS officer and you speak with them.
Yes.
And because every week, these things are sent in centrally, and they keep track, literally keep track of the numbers of mosquitoes that they capture at these different sites.
Well, I can tell you, in Auckland, the environmental health people went to do some fogging, and there was no equipment, no truck to put the machine on. So I don't know how serious they are.
That was post-walking?
Yes, ma'am. post-war game.
But you saw the difficulties that were present
There was
at
no
that time.
vehicle for them to put the fogging machine on. And they must have known that before even leaving New Providence. And
The only way I can
we want to
speak to
talk
that?
now about the efficiency of fogging and whether or not real fogging can take place when you have an absence of equipment or just wanton neglect and negligence.
I think, though, that's not the approach that we need in terms of Zika, though, because the answer to this virus is not fogging.
What is it?
The answer to this virus is prevention.
Yes, but if you have a mosquito-ridden community, Godfrey talked about the
What do you
heavy
think would be more
downfall
effective?
of more rain
What do you
than
think
ever
would be
before.
more effective? If you have the life cycle of the mosquito, you have an adult, you have the eggs, you have the larvae, and the
To break the
pupae.
life cycle.
Which do you think is more effective?
The egg.
Dealing with the adult or dealing with the younger stage?
I'm concerned about the mosquitoes.
The best way to get rid of that mosquito
Yeah.
is to break the cycle at the early stage of
Okay,
life.
good.
So the fogging, I probably shouldn't say it as such, but the fogging just makes people feel better to see it. The true answer is prevention. You have to prevent the life cycle of the mosquito by getting rid of the breeding sites.
Yes, but there are islands of the Bahamas where it's very difficult to do that. You have ponds.
Where they
all
put
right?
the guppies to make sure that the guppies
have
eat the mosquito larvae.
You have ponds all over the southeastern
They
islands.
use the guppies.
The guppies?
Yes. They put guppies in the ponds to eat the larvae.
Yes, but who is doing it?
DEHS. It is done. It is done. So I don't want persons to take their takeaway message to be, oh, fogging needs to be more, you need to see more fogging, or we need to have more vehicles out on the road doing this. It's not fogging. The answer to Zika is prevention, eradication of the breeding site. That is the only way you can effectively control the vector. And the only way to do that is to teach persons to be responsible for the upkeep of their yards, their homes, their communities. That is the effective way to deal with Zika. And that is the message that we're taking to the public. That is the message that we want everybody to have at the end of the day. You want to stop a disease from spreading, this particular disease, you want it to not even come into the country, because even if Zika were to come into the country, if you don't have the vector in place, there'll be no disease to spread.
Okay.
So the crux of the matter is vector control at the early stage of the mosquito's life cycle.
Take that for granted.
I'm happy to hear that you
Yeah.
have tremendous confidence in vector control in the Bahamas.
Yeah. I understand what you're saying. We understand what you're saying, right? But the big part of the problem, Dr. Green said, we all know it, is implementation. How efficient is the implement? I've been to Lovely Bay, which is a mosquito. Hey, when I read a fellow was looking for the fogger. I remember.
You ever been to Lovely Bay? A mosquito lift you up, you know. Now, seriously, they'll actually lift you up. You do your hands like this, you have
A handful of
a
mosquitoes.
handful of mosquitoes, you know, hundreds of mosquitoes, you know, in the rainy season, you know. I don't know, but no vector control that can deal with that. But anyway, I go with you.
Yeah,
if you
yeah.
say that you have a good system in place, I support you. But that ain't what I hear coming from those islands, you see. I've been to
Mr.
Bimini.
Jones?
I've been to Bimini.
Mr.
I've been to Bimini
Jones?
just on.
Can I
on
tell
Friday.
you, the effort is being stepped up because of what we're seeing right now, because of the threat that is at our doorsteps.
Okay.
I understand what you're saying your past experience has been, but the efforts now of surveillance in conjunction with DEHS are simply this: prevention.
Okay, let's take a break here. Dr. Greenslade, Felicia Greenslade, our guest on the program today. We'll come right back.